Okay, I didn't know where you're
I didn't realize you were
Yeah. I talked to Kelly.
I should have, yeah. For the prayer breakfast. Yeah.
It wasn't just the issue. It wasn't the issue. Okay, so that's what, we got you. And I feel bad. This is what I said to the register. I said, it seems to me, under no
Tastes
circumstances,
drinkable.
and we can do it.
That's what.
Are you?
I said,
Right.
I know that's what I said. I'm like, when you told me that, I'm like, all these things combined.
It's tough.
She could have said that she from the outset that she was calling about table. And she said, this is so and so. And I was like, yes.
Katie, it's nice to see you. Oh. Have we started yet? I was like, we haven't started yet. So. Okay.
That's how I get.
Skeleton crew today, everyone. Welcome. Yeah, we didn't do it last time. Yeah.
Me too. Thank you, Mr. Chair.
Leaning out the bottom. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Especially here at the prayer day, we're not gonna do that. And that's what I always think of now whenever I hear the pledge. The prayer day will be offered by.
Mr. Chair, Delegate Bramer is set. So
Okay.
if you could note him as a speaker.
Thank you.
And
Yeah,
I think we
he's
know.
fighting whatever.
We know there's a number of people missing, and I'll announce at the top that this is the reason I moved several bills from voting into just discussion. I didn't feel like missing now I think over a quarter of the delegation for today. I hope it's not because we're meeting live. I hope it's just a confluence of events, but I'll be checking in. I thought about doing an in-person one in the future, but we'll see how that goes. I don't know. I got to do something about this. I really probably need to. Wait, who could it be? What do you have for me, sir? Our past chair, ladies and gentlemen, Pat Young,
Well, and
has come to present me with.
That's a picture moment. There you go.
They got
There
it.
you
if I could,
Sounds much better than salad, I gotta say.
when Eric told me that y'all were meeting in person again, and he had a crab mouth, I still have the gavel. So we hadn't met since I was the chair, and said, let me come in and give it to you. So
Yes.
more than gracious enough to let me stop.
Thank you. Can you just say to us a little bit?
Oh, yeah, Mr.
Okay, great. Good to have you here today. Thank you. So kind of you. All right, so we're gonna start off with a presentation today, and thank you all for being here, and we have, oh, right, thank you. Point of privilege, I'm going to recognize the Speaker Pro Tem for a moment, please.
Thank you, Mr. Chairman. I know we're all thinking about our speaker today, and she's very much in our thoughts and in our prayers, and we're sending to her and her family all of our support and our deepest condolences. So I just wanted to ask, Mr. Chairman, that we have a moment of silence on her behalf and in memory of her son.
I think it's an excellent idea. Thank you. All right, now, Brian Moroz from Sheppard Pratt is going to come and tell us. We like to have new programs, things that, and if you guys want to pull chairs up from the gallery there, they can sit alongside the desk. That's fine. Especially things that exist within our county and do services for folks, both in our county and outside. Pleasure to have you here today. You have it. It's yours.
Thank you, thank you. I'm Brian Moroz. I'm the Executive Director of Sheppard Pratt Hospital.
Marshall Henson, Chief of Intensive and Specialty Services of Sheppard Pratt.
Good morning, everyone. My name is Damian Lang. I'm the State Government Relations Director for Sheppard Pratt. Thank you for having us. Absolutely. We can get started on the presentation. So next slide, please. And then this is introducing ourselves, which we did, so we can move on to the next one. Let's talk a little bit about what Sheppard Pratt is for those who may not know what kind of work we do or the services that we provide. Just to give you a brief overview of the slide here, we're the largest private nonprofit provider of psychiatric services, which includes special education, substance abuse, developmental disabilities in the nation. We serve patients from 43 states. We're operating in 7 countries right now. We have more than 380 sites of service within Maryland itself. Although we are expanding our reach to other states and to other countries, our home is here in Maryland. We were founded in 1853 in our Towson campus. So this is our headquarters, this is our base, and this is where all of our employees live, and all the work that we're doing is housed right here. So that's a little bit about us. We can move on to the next slide.
So as we go through these slides, I want you to keep in mind about Sheppard Pratt, the scope of care in the behavioral health continuum. We touch every aspect of that, whether it's inpatient care or community care, transition care, as we go through all of these. Also, keep in mind the age that we touch. We teach children, adolescents, adults, geriatrics, so it's really the full lifespan of anyone could be touched by Sheppard Pratt. I'm not going to read through each one of the little sub-points, but I do want to hit our areas, keeping in mind if you think about where we touch the whole system. We do crisis work with psychiatric urgent care, so people can come in who are in urgent crisis, get an evaluation, get directly admitted. We have mobile crisis, which goes out and addresses things in the community. Inpatient specialty services, so we do child, adolescent, adult geriatric services at an inpatient hospital. We have 2 of those hospitals. One is our Towson campus, and one is our Baltimore, Washington campus. We serve intellectual disabilities, and we do specialty care, which is OCD, anxiety, psychotic disorders, trauma, eating disorders, sports psychiatry, and autism. We have residential services, so folks can come in and out, whether that's adolescent day hospital or adult day hospital. They can come into our services, get the services, and go home. We also have school services. We're the largest provider of non-public special education in Maryland. Along with that, we have residential treatment, so folks can come in, and if they need to stay longer, they can get that treatment. We do therapy and medication management in all of those services, whether it's inpatient or outpatient. We do housing and homelessness services. We found that if you have psychiatric needs and you don't have an address, it's very hard to get a prescription filled. It's very hard to follow up with that. So having homes and having an address is crucial to being part of that psychiatric care and really getting the best care possible. So we do a lot of outreach with our veteran services and housing counselors. Next slide, please. Community and family supports. We have a domestic violence center, early intervention programs. We deal with developmental disability services, whether that's neuropsychiatry. We have 2 inpatient neuro units, both again, child and adult. We do a lot of training, whether that's employment training, job training, vocational services. because behavioral health is a big issue and everywhere that we work now, and people need more supports in those areas. Care coordination in home services. Sheppard Pratt Solutions is really our outreach arm. When we talked about going across the country into this country into other countries, people have come to us and said, how do you do what you do? How do you do the Sheppard work that you're doing so well? And so we set up a solutions which really goes out and connects with other folks to give them that expertise, give them that support on how to manage and develop their programs. Of course, we do research and innovation with some of the leading cutting edge research being done at Sheppard Pratt, whether that's using psychedelics or work in schizophrenia. We really focus on the autism and neurodevelopmental services. And of course, all of this is database and shared. Next slide. So now we're narrowing it. We talked about the whole United States countries. Now we're looking at Maryland, and of course, we're going to narrow it down to Baltimore County next. So this is where we are across the state. All of those services, we touch from the mountains to the shore. We're in Southern Maryland. We're in Central Maryland. Of course, with Baltimore County being our home base, our largest hospital and largest services. I just want to, again, I'm not going to go through each dot on there, but I wanted you to see the spectrum that we deal with across the state. Next slide, please. So what about, what's our impact on the state? So we have more than 8,000 inpatient admissions. We have 55,000 plus outpatient visits. We have 6 crisis stabilization programs in residential treatment centers and more than 5,000 employees across Maryland. So it's a fairly big impact across the state. Next slide, please. So let's look at Baltimore County specifically. We have almost 1,500 employees in Baltimore County, a little over $75 million annually in earnings. We care for more than 11,000 Baltimore County residents. We have more than 5,000 residents receive care in our hospitals, and last year we had more than 2,500 Baltimore County residents were evaluated in that urgent care that I had mentioned earlier. So again, our Towson campus is located, if you're not familiar with it, it's wedged right between GVMC and Towson University. We're at the heart of that. So we're very much connected to the college, connected to the services around us. So I think I'll turn it over to Marshall for the next slides, but we'll go from there.
Next slide, please. Thank you, Brian. So before I start talking more specifically about our work in Baltimore County, I just wanted to talk a minute about Sheppard Pratt. So a lot of people ask, what is the Sheppard Pratt difference? And it's really what Brian just alluded to with our continuum of care. So we have built out a system of care that meets people where they are and provides the right level of service at the right financial point. We are in schools to deal with early intervention. We have clinics in Baltimore County as well as the state to deal with primary behavioral health care. We have our inpatient and crisis services, which really deal with your urgent and acute care. And then we have residential programs and services that really deal with that long-term care component of keeping people healthy and well in our communities. So what you can see on this slide is that by the numbers where we are in the county. We have our flagship operation, which is our psych hospital in Towson. Many of you know that campus well. We have an urgent care center attached to that. We have over 60 residential homes within the county where we're providing support services to folks with serious mental illness, substance use disorder services, as well as developmental disability services. We have 2 residential crisis programs, and these are really important within the county and within the state. This really allows us an opportunity to divert patients from emergency departments, and it also allows us opportunity once someone has received that highest level of care in an inpatient setting to then step down and start to make the adjustment back into the community and back into their day-to-day lives. We also have the schools that I've talked about, the mental health clinics, substance use programs, and we also operate some veteran services to deal with homelessness, as well as that long-term stability that we're all looking for. Next slide, please. We have 4 specialized mental health programs, autism being one of them, doing a lot of evaluation and level of care determination for that group. We have an adult residential treatment setting for those who need longer-term care supports to really integrate back into the community. We have 2 type 1 non-public special education schools, which really is that early intervention approach that I was talking about before. We are doing everything that we can to move our impact upstream and into early intervention, because that is where we see the longer-term generational impact of our services. We want to deal with where people are at today, but we also want to help people be healthy as early as possible in their lives. We have our Institute for Advanced Diagnostics and Therapeutics, as Brian touched on. We run several psychiatric day rehabilitation programs in the county, which allow individuals with serious mental illness to achieve a level of independence in the community, and 2 neuromotor modulation programs as well, really looking at ECT and TMS for those patients that have been treatment resistant, have not responded to traditional medications. Next slide, please. So I want to spend just a minute talking about behavioral health globally and the benefits of investments in behavioral health. And it really is that diversion and deflection impact. While we are helping individuals, we are also helping systems, decant systems, to keep people out of emergency departments and to keep people out of jails unnecessarily. So when you're thinking about investments in behavioral health, you have to consider the impacts that it has on the criminal justice system, as well as the diversion from higher cost emergency department care and inpatient stays. So there's a few of the challenges that we are looking at today, and we all understand the budget situation that the state is in. We just want to make sure that everybody is clear and understands what investments in behavioral health can look like over time. What we are seeing across the state, though, is an insufficient amount of inpatient psychiatric beds, particularly for children and the older adult population, and a shortage of crisis stabilization beds. So again, these beds that provide an opportunity for diversion from emergency departments and higher cost levels of care. And of course, we are seeing workforce shortages like everyone else. And what that means in terms of impact to provider, our ability to impact workforce shortages is driven by rate settings within the state for the services that we provide. We have all certainly experienced the inflationary effects over the past several years. Our rates have not kept up with inflation, and so that's putting pressure on our ability to do things creatively and longer term to help people achieve wellness and stability longer term. So that rate issue is something that you will always hear from us until we get to a level that we can treat all the people in Maryland that need the level of care that we provide. Next slide, please. Again, on the rates issue, we have studied several of our service lines and have established a delta between what the rates are and what it actually costs us to provide that level of care. So we have that practical information that can inform decision making. We have been targeting building out crisis stabilization centers, residential crisis services for that diversion from emergency departments and to provide the right level of care. And we're really interested in the child and adolescent space for the reasons that I said earlier. The more that we go upstream and work in schools and start working with individuals earlier, the better the outcomes for those individuals long-term, and the less cost it is to us as a society over the long term in terms of medical costs. So the residential treatment services that we provide in Baltimore County are to the most acute children and adolescents in the state. And that's a model that is not financially viable. So we are consistently looking at other opportunities to augment those services and funding in order to provide that vital service. Next slide, please. And Damien, I'll hand over to you.
So we do have a few initiatives and funding needs that we wanted to talk to you all about. In terms of capital funding, we're looking to develop out our Towson campus by building a new pediatric psychiatric facility on that, which is going to include crisis beds for folks. And that's the first section. The second one, we're concerned about two aspects of the BRFA as they relate to consortium funding and CCDHC funding. I spoke about the consortium in the BRFA hearing yesterday, so I won't belabor that point for the folks who are on appropriations and ways and means. But specifically for CCDHCs, let's speak hypothetically about a patient going to a CCDHC versus going to an ER. If they're on Medicaid, going to an ER, that's going to cost the state $5,000 to $6,000 per day for that person going to an ER. Whereas if they went to a CCDHC instead, the highest echelon of that cost is going to be around $850 per day. So this is a program that we've been implementing since 2018 that is a real long-term cost-saving mechanism for behavioral health. CCDHCs exist in about 41 other states, and we're implementing it in Maryland right now. The issue with the BRFA, however, is that it removes MDH's obligation to renew grant applications because he's currently relying on the federal SAMHSA grant. So this is a program that we're implementing at no cost to the state that we're asking you all to take a look at and make sure that we continue to fully implement this program because it's going to save lives and it's going to save the money. It's going to save the state money. Next slide, please. So here are the specific pieces of legislation that are really going to affect our services and services for Baltimore County residents. So we already spoke about the BRFA before, SB 359, HB 185, the Therapeutic Child Care Grant Program. This is essentially extending an appropriation for the Therapeutic Child Care Grant Program, which focuses on developing out health and medical child care in coordination with early education. So that piece of meeting folks upstream with their needs and addressing that intergenerational systemic disparities that we have, where it's working with families, it's working with children, where investment is going to have the highest impact early on. And I think the Senate bill actually just crossed over, so we're hoping that that's going to make it through all the way. As for the Preserve Telehealth Access Act of 2025, Sheppard Pratt, we have provided over 200,000 telehealth appointments in this last year alone. It's a growing part of mental and behavioral health care. It's going to continue expanding. And essentially what this bill does is it removes the sunset for Medicaid coverage for telehealth appointments, enabling folks to have telephonic appointments. They don't need to be video. So for those folks who may not have the technology or the access to have these appointments, they can still get the care that they need and be covered by that. So that's going to be a very impactful bill that's going to help save people. The next one, Behavioral Health Crisis Response Grant Program. This is an extending appropriation as well. And this has been a very impactful program because it's funding crisis stabilization programs and our mobile crisis teams, which are able to meet people where they are in those times of crisis, which can prevent them from taking more drastic steps or ending up in the ER, which saves lives and saves money. And the last one, the pediatric hospital overstays. This is a serious problem that's been happening in our state. I think right now we have, I think it's like 70 children right now who are experiencing overstays. And these are children who have nowhere to go. They are medically stable. They have met all of their needs at the hospital, but they don't have a place to go. They're either in foster care or their parents have abandoned them, and they are stuck, and they are costing the hospitals money, and they're essentially in a prison-like system where they can't leave. They're not getting education, and they're just belaboring in the room. So this is a really serious moral and ethical quandary that we have in the state. And what this bill does specifically is it requires MDH to put these children in the least restrictive environment possible, helping to get them out of these hospitals and get them in a more supportive environment. And it also includes a study for rates that we think is going to be really insightful in terms of seeing where these issues are coming from and what solutions are going to be very practical in terms of ultimately ending this as a problem that's been really exacerbating pediatric care in the state for a long time. And those are the main bills that we have that we would love to talk to you all about if you have any questions, but that's all that we have. Thank you so much.
Thank you. Thank you very much for being here today. We really appreciate it. Appreciate about all the services. We'll let members ask a couple of questions if you don't mind, and we'll hopefully like this. So totally agree. Go ahead.
Thank you, Mr. Chair. Thank you for this presentation and for all your work on this important issues. In relation to the workforce shortages, there's obviously going to be a glut of former federal workers that are looking for jobs. I know you need people who have a specific skill sets, and is there any possibility that some of those might have that skill set?
I'll defer to everybody on there. So I'm very focused on the hospitals themselves and operations. So as you stated, a lot of our work is direct care. Direct care workers, the frontline folks are the most impacted. But as we certainly need leadership positions, and we need those people who connect certainly with government for that support. So I think there's opportunity, but really the big focus is that direct care, certainly in the hospital centers and probably in community care also, but I'll let you know.
No, I think that's right. I think that in some situations it may be a perfect match, and in other situations perhaps not so much. But because we are dealing with workforce shortages every day and have been for a very long time, we tend to be very creative. So we will continue looking for opportunities for those that are displaced more recently.
Thank you.
Other questions? Delegate Bhandari.
Yeah, thank you so much. All of us know that the ER wait time is the worst in the nation. We are 50 out of 50. So the General Assembly passed the Governor Commission on wait time, and the commission is working. And we would like to know how you guys are collaborating with them.
So we collaborate on the actual folks that are with the hospitals themselves around the people who are staying in the ED who no longer need life or death treatment, just for, in that continuum of care, you go to the ED and they're very focused on, are you going to live or die tonight? Can we keep you going? And they stabilize, and then people get stuck, as you said, and that's across the spectrum, whether it's medical care or psychiatric care. And psychiatric care tends to be the longer stays. People tend to stay in the EDs longer. What we've noted is we run at pretty much max capacity all the time. There's a need for more beds across the state, not just inpatient beds, but residential treatment beds. Children get stuck and they need that level of care. And that is tied to those rates. For each one of those to expand, they need to stay afloat. So we do talk about how to get them out immediately. So on a day-to-day basis, we communicate with the ERs, and then long-term care is where we're speaking with the government about how we can make this achievable and sustainable going forward. But right now, with those rates, it's very limited. If that makes sense, I can spend more time.
We could talk offline. Okay. Cool.
Thank you, Delegate. Delegate Phillips.
Okay. And I have three. The first one is regarding assisted outpatient treatment and the implementation, because I know that's coming. The second one, and I will mention to you that I actually have a bill which would make certain persons in that category prohibited persons to have firearms. So that's of interest to me. The location of your residential housing. I'm a judiciary, I'm thinking restricted. Residential housing, if there's like a map that you could share with us, not addresses, but just kind of where they are in the county. And what's the average length of stay, particularly for both your inpatient and residential?
Well, take a lot of those communities.
I'll start with the last one because that's the last one that I looked at. Average length of stay. So when we're looking at our inpatient psychiatric, the highest level of care, we're typically looking between 10 and 14 days, right? Many of the commercial hospitals around the state have inpatient psychiatric units. Sheppard Pratt often receives referrals on those harder to serve patients, those more acute patients. So those that need more specialized care tend to be referred to Sheppard Pratt, which drives our length of stay up a little bit longer because we're dealing with the more complicated cases. But that inpatient tends to be about 10 to 14 days. For residential crisis, and this is a line of business that I'm extremely passionate about because of the power to keep people out of the emergency departments and to keep people from cycling back through inpatient and jails. In our residential crisis housing units, our average length of stay is about 10 days. We can go up to a 30-day stay for those that really need that additional support before integrating back in the community, but our average is 10 days. So as you can see, with both of those, if you think about it from a step-down process, we're receiving somebody at a very, very acute level of mental illness. We're able to treat in an inpatient psychiatric setting in a short period of time, 10 or so days, step down to a crisis residential setting, get some of that transition treatment in the community, and then get back on with your life, right? That's the model. It works. We see it over and over again. There simply aren't enough inpatient beds or enough crisis beds in the community to meet the full needs of Maryland.
Get them all three.
AOT, assisted outpatient therapy. I think.
Can you explain that for us as well?
Yeah, it provides opportunities, much like civil commitments for providers to make recommendations, stronger recommendations for someone to participate in outpatient treatment. So really trying to move someone into care who seems like a danger to themselves or others. We have started working with DHSB, Behavioral Health Systems Baltimore, who's running the pilot for the state and with surrounding jurisdictions, including Baltimore County. Very early stages of that pilot. Generally speaking, I think we are encouraged at the opportunity for us to be able to provide some more compassionate encouragement to people who need help, who may not actively or voluntarily seek out help. So I think we have a ways to go here, but I think we have a real opportunity.
Okay. And then the last one was location.
And locations for residential services. We can certainly share the map that we had on display today, but we can also get you some general locations of where our residential services are, so that you have a feel for the constituent areas that you're in that may be impacted.
And on that subject, if you wouldn't, you communicated with John Sanick, who is our administrator, if you would send him this slide, if you don't mind, and he will take the responsibility of sending it out so that we can, people, we go by quick, and sometimes I like to come back and review, so if you're willing to share, we'd certainly appreciate that. Vice Chair, Pastor.
Yeah, I'd like to
Oh,
tie, I
yes,
just
sir.
wanted to tie three things that we mentioned together for a picture. When you talk about length of stay, which you asked about EDs and borders, and we talked about people getting stuck. I just want to give an example of what that might look like if you get a child who is done with inpatient care, meaning they need less restrictive environment and ready to go. We 10, 14 days, but they get stuck. And sometimes they get stuck for a month, 2 months, 3 months while we're waiting for a placement. So you would think if that person could move on, I would have treated one more person, but actually if they stay 3 or 4 months, we could have treated 5 kids in that same time period. So that leads to a backup, and because we can't clear the inpatient bed, then we can't take from the ER, and so it all mounts and it connects in that continuum of care. So I wanted to tie the dots between the questions because they really impact each other. So thank you.
Thank you for that addition. Vice Chair.
Thank you, Mr. Chair. I want to start by thanking you for being here, but more so thanking you for the work that you do with children and teens. I've worked for 263 years in Baltimore County. And
She exaggerates, it's 261.
more. Thank you. And at one school particularly, I got to really understand what Sheppard Pratt does for our students because of that particular school. It is a very high-flying school with wonderful children doing wonderful things. And they started calling Sheppard Pratt 2. And I wanted to know what 2 meant. It meant the name of the school, 2, because on weekends and various other times, they knew that they needed to be at Sheppard Pratt just to help them keep themselves together. We tried, and I was responsible for special education and special needs. So they would come to me and tell me this and give me a sense of some of their problems, but it was very clear that they had a relationship with Sheppard Pratt, that it did not take a real crisis moment, but they knew that they could go there and pull together some of the things that were not working for them, even though what they were doing in school helped them a great deal. So I appreciate that. And my question goes to the relationship, and since I'm a Baltimore County person, this is the delegation, I'm going to ask about Baltimore County. What does the relationship look like with Sheppard Pratt and our school system? And just one more very quick anecdote, because this was a little bit more serious, with a student who had been in foster care his entire life, had been in self-contained special education his entire schooling. And one day he came in and said, you know, I'm hearing these voices, and I've been hearing these voices for a while, but they're getting stronger, and they're telling me to come in and kill people. So we just swooped him up very quickly. But it didn't take but a moment, it seemed, I mean, immediately, for him to be at Sheppard Pratt. He was there for a while. And when he came back, just a completely different person. Testing, went on to the community college. If you've ever taken, just for fun, acuplacer, which is not easy, he scored. He was just like almost a perfect score. So they came in to understand how this child could have been in self-contained all of his years, looking at his scores, because he was so completely different. But it is what happened to him while he was at Sheppard Pratt. Now, I want to believe that that wasn't just an accident, that the people in our counseling area knew what to do, what to say, how to handle it with you. So what does that relationship look like?
Yeah, in every jurisdiction, it looks different. But I will say within Baltimore County, we have a very strong working relationship. We are in the schools in some different ways, but we keep that liaison relationship very strong for exactly the reason that you're describing, right? And we have started a number of these consortium projects. For those of you that are familiar with the consortium project, that really we are implanted on the ground in schools, able to identify those exact scenarios that you just laid out, right? You have a student with a potential emotional disturbance or need that escalates to a serious level that we all in this day and age have to pay attention to. And so we're working closely with administrators, with counselors, with teachers to be able to identify those touch points where we can make an impact. And I'm really appreciative that you shared that story because we get to see that every day, right? We see folks in serious need come in, 10 or so days later walk out and be a whole different person, or the person that they were before they got into crisis. And that's a great thing to see. But to your point, we have to do more in the schools, right? The earlier that we intervene in anyone's life in relation to mental illness, the less it's going to cost the state, but more importantly, the impact to that individual. Studies have shown time and time again that the earlier you can intervene on mental health, the healthier that you're going to be all throughout your lifetime, not just mentally, but physically as well. And when we talk about workforce shortages, we talk about our communities. We need everybody. We need everybody to be healthy. We need everybody to be productive. So it's important that we're in schools. It's important that we're in those community touch points so that we're following that contingent all the way for folks.
And if I could just add on real quick, I think this is why when we're talking about the proposed cuts to the consortium and the BRFA are particularly concerned because the consortium provides for behavioral health workers in schools, for social workers, it provides training for teachers so that they can be more aware of the behavioral health problems that are coming up in their classrooms. I used to be an educator myself, and I know that when you're teaching, you're worried about every child, and if one of those children is having a crisis, it's a detriment to themselves, it's a detriment to their peers, and you may not have the resources to deal with that child in the moment, but the consortium provides those resources so that child can have someone to talk to at their school. That can be another link in that support chain. Sheppard Pratt, we're the last step for a lot of folks. If someone's at Sheppard Pratt, there have been multiple supports that have failed them. And we want to prevent people from having to come to a crisis center. And it's things like the consortium that are able to catch those students that otherwise would be able to have a happy and productive educational outcome. And with those cuts to the consortium, it's very likely that some of these students may not be caught, may not get the help that they need, and may end up being a detriment to themselves and be a part of this systemic backlog that we have and failing to get the help that they need. So, yeah.
I also wanted to add, first of all, thank you for your 243 years of service. But that's right. I too have worked with children and adolescents most of my career. I'm a registered nurse, and I have worked with children and adolescents for 25, 30 years straight now. But specifically to Baltimore County, you asked, so we do incorporate a whole bunch of levels of care in connection with MSDE. So we can go into a school and provide supports to teachers. We can go in and do special education within a school if they don't have a special education program, which we do. We also have an independent special education in Glendon. So it's a very large school in Glendon, which we are right now doing a lot of renovations there. We're invested in that community, we're invested in that school. And then, of course, on the main campus in Towson, we have the Residential Treatment Center, which also has a school attached to it. So those kids can get education while they're in treatment so they don't fall behind. So all levels of care, we work with MSDE because all of the services that we provide have to be approved by MSDE. So we're connected with them on all those levels within Baltimore County. So I really wanted to answer specifically for that question.
Yeah, I thank you. Just one last thing. I want to thank you. I'll just give his first name, Brandon, because his parents are so thankful for his time. He is on the autism spectrum. And we don't process in schools. Schools need staffing, needs to have more connection. This child was on the autism spectrum. By the time he got to the first school, Brandon in the 11th grade had his work showing at the Smithsonian. He is nationally known now as an artist, a painter, a sculptor, and he would not have been able to pull all of that together. I still have his 3,000-piece puzzle that I did.
So now I think you're going to take Delegate Pasteur on tour with you and let her tell that story. It's
So thank you.
quite a ringing endorsement, and good on you. It's important to mention that you have a school in Baltimore County. That's what we call a non-public institution for students that the county needs special help with in Hunt Valley. And when I'm wearing my other hat as Education Subcommittee Chair on Ways and Means, I've been out to visit your facility there and toured around. I don't know how public that is. Maybe it was special because I was education, but I bet there'd be a few people here who might be interested in coming to see that facility and how you work. So if that's true, if anybody says it to me, we'll get in contact with you because it's there in our county. I know that students are not all from Baltimore County, but you do work interactively with county schools in doing that. Also, the word consortium has been tossed around a good deal. I also have the pleasure of being the House of Delegates representative on the board of the Consortium of Coordinated Community Supports. If we didn't know we were going to have to say it that many times when we named it, we would have thought more carefully about it. And it is, and what they're referring to is that that was originally funded at well over $100 million, and the BRFA currently calls for it to be funded at a lower $40 million, and that's probably what you testified about yesterday. So they're making a pitch for that. Everybody's making their pitch, but we appreciate yours as well. I think that, did you say I had another question? Yes, Delegate McCaskill.
Good morning, colleagues. And I may have missed it, so please forgive me, but as you all may know that I sit on appropriations and even more in depth, I sit on Health and Social Services Subcommittee. So you know this is one of the main things that you're looking on when we looking at line items. I felt like I went to bed with BRFA, I woke up with BRFA this morning. And so it's all running through my veins. But I want to turn to pediatric overstays, hospital overstays. We know that we have to do better. We know that we have charged the Maryland Department of Health to do better, and which specifically 962 hopefully will do, because we cannot continue in the path that we are in. But I'm curious, I think you mentioned about expansion. And we know that a lot of the children that have these 5-month hospital stays are those kids who need the most care, right? With their behavior. So are you at capacity as far as your beds, or are you having beds but you don't have workforce to cover?
Yeah, that's a great question. We are always looking at, I'm going to take our residential treatment center as an example, right? We are always looking at the acuity of the population of that service. So what do I mean by that? how difficult is everybody that we're serving in that program today, right? How challenging is that? So we are dealing with emotional disorders. We're dealing often with things that play out as aggression, so physical aggression on staff, physical aggression on others. So we have to staff it that way, right? So to your point and the workforce question, yes, we are hampered by workforce shortages, right? That will limit our ability to fill beds. But the acuity also limits our ability to fill beds. So if we have a lot of folks with a lot of physical needs at any given time, we may have to back off of a couple of open beds and say, we're gonna hold tight right here for a minute while we get these folks stabilized before we accept anymore. All of that said though, the core challenge to us is the rate structure, right? Because, and we have done this with the state in the past and looked at single case agreements where we negotiate and we say, this is how much it's going to cost us to serve this patient. If you can support us at this level, we will gladly serve this patient. And we've done that, right? But at the standard rate that we are able to be reimbursed at today, we can't pull in those one-on-one supports or those two-on-one supports that are needed for those most acute cases. So it's really a complex picture that we're looking at every day that really boils down to two access issues. We need to create more beds, and we need to be able to move to a rate methodology that fully compensates providers for that intensive level of work so that they can fill those beds and staff those beds and really get beyond some of the workforce challenges that we're having today. So rates help us meet the workforce challenges.
Okay, perfect. I'm glad to hear that you speak quality versus quantity. And I am glad to hear that. I'm just it really disturbs me about these children with these hospital overstays. And then we place them in facilities that are not regulated, hotels. And we talk about these restrictions. And these kids are staying in hotels and cannot be with their peers and get the educational services they need, and they are restricted to their rooms, if you will. Not sure how the whole thing, I just want to make sure. When you speak of state rates, so you don't accept patients who with a mixed delivery payment. At the state rate, you accept them, you are expected to accept them for what the state pays, and that's it. There's no other mixed delivery when it comes to serve payment.
By and large, that's right.
Okay. All right. I just need some clarity for that. Thank you. Thank you, Chair.
I think that exhausts our questions, although you had a lot of really high quality ones, and I appreciate your answers. We also appreciate you because we're experimenting with meeting in person. We appreciate your willingness to come to Annapolis. It used to be a regular expectation. Now people are a little bit unsure, but I think in person is actually a lot higher quality in terms of just seeing you guys in person, having you answer questions. So I really appreciate you being here. And thank you very much. You're welcome to stay or not be bored and go. So it's up to you.
Thank you.
Yes.
Thank you.
Go ahead and keep going, get their thing back and put up the screen and we'll get moving here. We, because we have a skeleton crew here, wait a minute, something fun happening behind me. Everybody's looking over my shoulder here. My goodness. What do we have? We like to honor our past chairs, even in their moment of service, whatever service he was doing in that uniform, I'll never know.
I know where you wanted me to stay now.
Yes. Hang out, and you'll be rewarded on some level.
You want me to take it?
I don't know, I kind of like having it because I can spring it on you whenever I want. It's kind of great that way. So,
that's a valor.
Yes, no doubt. Anyway, thank you, and you, of course, now that you've seen what you were being set up for, you can certainly leave or you can hang around also. Because I know you have another meeting going on this morning as well at the same time.
I'll be back with you guys.
Okay, we'll look for you. Thanks for being here, by the way. It's great to have you. It's AI. It's AI. Yeah. It's been around a while, and I've sprung it on him several occasions. Okay, he actually had a name, but I stole it from him. I make it appears here and there. We were touring the New Kingsville Library, and I said, "Here's some artwork that we're going to hang in the library." All that. All right, we're going to have a quick discussion, or maybe a long discussion on some bills. I'm going to go with the one that I think probably doesn't merit much discussion. We had a hearing and talked about it. Does anybody want to weigh in at all on the library unionization of the supervisor's bill at this time? Okay, that's a silent room. We'll move on. Now we need to talk about a bill that, because it requires some bobbing and weaving, it's not as if we've never talked about it before. This is a slightly different bill, of course, than the bill that we spent some time on. It was kind of my hope that we could get all through this today and, push it into our past. But as I said, we just didn't have enough people to make it a robust vote on this bill that people could weigh in on properly. I will tell you that I've had extensive conversations with Delegate Cardin, the chair of the subcommittee, and with Chair Corman, the chair of E&T, who has an attitude that he wants whatever we pass to be in keeping with what other what other jurisdictions have done this. As far as I can, there are at least 3 others that have done this. Prince George's County has done it along Indian Head Highway somewhere. I think Anne Arundel or Howard has it along Route 100 somewhere. And of course, Baltimore City, we are all familiar with this because we have to watch that one. When you're zooming in on the JFX, you zoom a little slower because there are cameras there as well. There have been a number of amendments. And first, I'm going to address the amendment that there are several amendments about signage and announcing where they are. We could try to put in more specific language. SHA says that what they do already is in law and that there is signage. The distance it is and all that is not prescribed. I will only say that I think we should go along with the state. This is going to be put in a section where it matches up to either a copy or we put it in, I forget which it is. Are we going into the section where Prince George is establishing our own now?
No, we're keeping it where it is.
Section of law, but we're going to use that language that they have.
It matches already.
It matches already. That there have been no significant complaints in those jurisdictions about people saying they didn't know the cameras were coming. And so I'm going to advise against overkill on this one and say that we should stand and probably not go forward with those amendments. This is up to, of course, the subcommittee and members that if they want to bring those amendments, they can. Does anybody want to weigh in on the business of signage announcing that there are speed cameras as far as putting them on the beltway? And
what is the current law?
What's that?
What is the current?
Here we go. We got a counsel for this. Here she goes. She's taken off of that. What's the other highway delegate sign? Not the beltway, but also 83, but not 795.
Correct, not
Okay.
795.
Okay. What's current law?
There has to be a sign before the camera, before you approach the camera, that indicates that the camera is in use. And it has to comply with the State Highway Administration guidelines, the MDOT guidelines, and each sign, there has to be a device that gives you your real-time speed at the site as well.
When the lights up, like when you go on the Bay Bridge.
So how far before the cameras?
It's not.
That's not.
We are fortunate to have been visited by someone who thought we might be voting on this law today, but she's here anyway. We have April King from SHA. So if you can give us an indication of how far come on up, have a seat. You can give us an indication of how far you think those signs generally are. It's not in law, but what State Highway has been practicing so far. If you have an idea, that'd be helpful.
Hello. So we do not have a specific distance that we put the signs ahead. It just is dealing with the road condition and placed in with other signs that are already on the road. So we have to follow the federal guidelines of where we're placing our signs in accordance with the federal guidelines. So we do like to put them, of course, to give everyone notice that they are going into a corridor and there is a speed camera approaching.
As much as it takes to answer your question, no, that's good.
Well, I just didn't want the camera to be here and just, or sign to be here and sign speed right there.
I don't think that's the intent here.
Right.
We don't have it in law, but apparently, we haven't, in other words, I asked some of the people who live in the, who work in other jurisdictions, delegates, I said, you get complaints about these cameras, and they don't, as far as knowing they're there.
You just gotta do something so people.
Yeah, well, the whole thing I would say about this is I believe, and SHA feels the same as me, this is supposed to be preventative, not punitive. It's not, money will come in, however, the idea is for people to know they're there, and generally, as many as 8 locations around the Beltway, we're going to have, hopefully, people driving slower than they do right now.
It's been my understanding that on 83, where they put them on the Jones Falls, that has really slowed the traffic.
Yes, and I think that's helped because when the Jones Falls is particularly.
And reduce accidents.
Yeah. Doug, Son, did you have your hand up?
Yeah, I just wanted, one small commentary on the road sign. The language that is in here, which I think mirrors the work zone language, is it has to be a conspicuous road sign. So, that would be in the law.
Okay, and that's in the bill as we wrote it?
Yes.
Okay.
What's that?
Is that an amendment? That might be an interlineated amendment.
No, but it is an amendment.
Okay.
It's an amendment.
All right.
Yes.
So I don't, we have a committee that's pretty particular here. I'll say that in the nicest way I can. But, so I don't know, putting the word conspicuous in will turn them off or not. I will point out that if we're doing new things, ENT can, because it's really, we're putting in new concepts in there, they can strike them. You would say local privilege, but if we're doing something that sets a precedent, they can say we're just not gonna do that. So I don't want to get into a push me pull you with them, because I don't know how the rest of you feel, but generally I think this is not a bad idea for us on the Beltway. So I'd like us to find a way to get it done that they'll do it. So let's think about that carefully if we can. Were there any other questions on, yes, Delegate Long?
Third time.
Third time.
Yeah, third time having me on. Question I have is, you said something about cameras, speed signs, you can let them know what their speed was. Is that prior to the camera or is that at the camera?
Do you have any idea?
No, that would be a local on the state side. I would have to check and see, do we have those speed cameras at the speed camera?
Okay.
So do we give those signs right at the speed camera to say what the speed is? That I would have to double check. I just want to confirm with our team that we have that at every speed camera.
I thought, Mr. Chair, I believe the law is silent to that, and that was part of the reasoning for the distance here. It doesn't specify where those would have to be.
Okay.
So my question is, would the sign that flashes, you're going over the speed limit, would that be prior to the camera? Or it's not included in this legislation?
I think the nature of this question is it right at the camera so you know how you're doing?
Or
is it generally set up as a warning if you're coming to it that this is your speed and you're over?
I can confirm with our Office of Traffic and Safety, but I think the operation is prior. So you can see where your speed is, and then the camera.
Because I was going to say, if it's right at the camera, you're going to know once you go through the camera, light goes off, you already know your speed.
Correct. I do believe
The
that
other
it is
option is
prior.
to go closer to the speed limit, but never mind that. All right. All right. Somebody else, I thought I saw another hand on this.
Are we going amendment by amendment or?
We know conceptually, not every amendment, but this is the one we're talking about.
And then you're gonna go down?
I'm going down the other.
Okay,
Yes, I am.
so can I just say something quickly?
I would like you to.
April, thank you.
Oh, you're
You've
welcome.
been so helpful. I really appreciate it.
Yeah, she showed this morning,
Carry
and the message didn't get through to her. I said, April, when I vote on the bill today, I saw her face drop. I
I didn't
think,
mean on this. I mean,
No.
she helped, I'm sure, all of us with Easy Pass and other things that challenges our constituents have had, and bravo to you. Thank you.
Oh, thank you so much. I know I've made my rounds around MDOT.
And
From
you had a way to-
UTA to NBA, now SHA. So
Yeah.
if anyone needs any help, I'm here to help.
great on you. And you had to wait a whole hour, but
Yeah.
we are actually relying on what you know and what you don't.
Absolutely.
Like SHA will commit to and hasn't, or has. So it's
Absolutely.
very helpful to have you.
Thank you so
The
much.
next one, the other one was about spacing of them. You can sit there. I don't think anybody else, if you would like to discuss some others, I don't know if you want to run away. You don't need to keep coming back and forth on saying, you can just hang out and listen, and we'll turn to you if we need you. How's that sound?
Sure.
The other one is spacing, and the amendment that's going to be added is that they be spaced at least 5 miles apart. on the same side of the highway or in the same direction. We cleverly call it inner loop and outer loop, but I don't think we're gonna put that in law, but that's the idea. I don't know how we characterize it. I've been speaking with the chair. He thinks this is perfectly acceptable and that we should go ahead and amend it that way, especially since we're putting in probably more cameras than some of the other jurisdictions are. You know, there would be as many as 4 as you drive around the Beltway one way and the other way. But they can be directly across from each other on opposite sides of the highway. So I think the EMT think that's a good amendment. Sounds like a reasonable one to me. Delegate Shalay.
If it's just going in Baltimore, is this gonna be statewide or just Baltimore County?
I think we're just
Then
approving.
just use inner outer loop, like, use the words we
Well, we'll
understand.
let the drafters decide
Yeah,
what
I
works
mean,
best
that
there.
would be my suggestion, and then actually we should try to make it so regular lay people can
Right.
understand.
We never do that with the laws. Come on. So, yes, that's a great idea. That really is. Another amendment that was offered is that we notify county council members that they're being put in their district. This was mostly by the chair dismissed out of hand as not a good idea, that we don't really have state agencies report into or not necessarily feel they have to communicate with county level people on state things. So I think this would be a poison pill if we added this as an amendment. Yes, Delegate Ford.
Thank you, Mr. Chair. There is a notification, public notification before they start a speed camera.
Well, yeah, we'll get to that amendment in a second. While we're in it, doesn't matter, there's no order here because we don't have any motions on the floor. There has been a grace period in the bill.
Yes, I'll just say, so there was initially 90 days. My amendments, I conformed to the waivers that passed the Senate and the county delegation, the Senate took that out, took out the 90 day warning.
So you can only get a warning for the first 90 days, but when the bill is written.
But that's right. So long story short, the way I think subcommittee chair is proposing is with 30 days in, and that's at the request of the recommendation of the state police. I talked with yesterday, and they probably don't know if you have confirmation of that.
So I would have to hand that over to the state police.
Okay,
That is the state police.
That's wise of you. I don't keep you here, but you don't have to answer every question if you can.
In speaking with Catherine Kelly yesterday at the state police, she said 30-day warning is what they would request, and it's their current policy.
So we'll need to amend it up to get it to that number.
I think, right, Delegate Cardin has an amendment which would propose putting 30-day back.
Charity says that it exists.
Yeah.
Just to clarify, because people need to know, 30-day grace period from the beginning of the program, or 30-day grace period after a camera is placed. In other words, if SHA decides to move a camera, will there then be another 30-day grace period with that camera?
I don't believe so.
Okay,
No,
so it's the beginning of the program.
I mean, what the state police said is that they're typically, when they move a camera, there's typically a few weeks, but not, necessarily 30 days.
You're nodding your head. Is there anything you want to add? You don't have to.
It's not at the beginning of the program.
Okay, thank you.
In the beginning of what?
The
program. In other words, once we start the program for 30 days, wherever they're placed, there will be 30-day grace period. But if they move a camera, it does not restart according to the way the bill is written.
Wait, does it restart?
The 30-day grace period wouldn't be each time the camera is moved.
That doesn't sound right.
Well, I mean, it's the way the bill is written.
Can we change that? I mean, that's our job.
Maybe. I'm reluctant, as you can tell,
Yeah.
because I'm trying to find, I'm trying to grease the skids a little here on this one.
Yeah.
So let's think about that carefully.
Can I speak to that?
Yes, please.
Very
Happy
quickly?
to have you.
So the notice is because there are no speed cameras on 695 or that portion of 83 currently, correct? So that notification is just to let the public know there will now be speed cameras on these corridors. If we every time we move the camera and have to give the 30-day notice, everyone is already aware that there are speed cameras on that corridor going both ways. So that is why the wording is at the beginning of the program.
Yeah, sure.
So when we do say Baltimore City, we're talking about a very narrowly defined stretch of road on 83 there. The Baltimore Beltway is almost 52 miles, right? So
we're talking 104 miles of road.
Right, and if you count both, yeah, exactly, and out, right? We're talking about over.
Notice how quickly I multiplied by 2. Impressed.
So you could theoretically be moving a camera from near site of the old Key Bridge to somewhere, presumably very far away. It's almost as if you created a whole new program here for someone else that may not have had a camera there. I know it's not a new program because it's 675, but respectfully, I think that's a little bit different than kind of just, moving a camera, say, within a school zone or something like that. There's a big mile difference there. That I think we should give folks notice that this, you've got a camera now that could have been moved 50 miles in this case.
Go ahead, Mr. Chair. Just, reiterate what the state police said, is that when they move a camera, it's not like the next day. They say it's typically a few weeks, but it's not their practice with respect to, I believe, work zone cameras on state highways when things are moved to be required to have a 30-day notice period in advance of it becoming effective. So there is lag time. It's going to be, they say, practical terms, a few weeks, but their policy is not to say every time something is moved, it's 30 days.
Mr. Chair?
Yes, ma'am.
Let me get some clarification. When we say the beginning, the start of a program, and we're doing notification, are we notifying for a one specific area, or is it a stretch of?
So to clarify, we're actually not discussing notification here. We're discussing the grace period, I think. Is that correct? We're really discussing how long of a grace period.
I thought the two were tied. I'm sorry. I didn't mean to jump in.
Okay, no, that's fine. Really, this is pretty informal conversation.
But I thought the two were somewhat tied, right? Because
Yes.
there is some type of a public notice before we actually start the program, correct? And they start putting up the equipment, which is also almost like a public notice.
Right, I'm trying to figure out what we may need to do from the start of the program and public notice on both ends, what might need to be done.
Okay.
That's why I asked the question.
It's a good question. Anybody? Oh, yeah. Delegate
I have a couple of
Delegate.
questions. So I was looking at the bill, how high-risk areas are determined? How do we do that?
The high-risk areas?
Yes.
So we use the data, crash data, we have the safety corridors that we can identify, but we analyze all of our data before we would go and move the camera.
And if you remember, in the hearing, Delegate Stein put up a couple of maps to show some of it was a color map that showed red zones, where there were fatal crashes and crashes.
Yes.
And another question is like the data storage limitation, are they automatically deleted after if they are not challenged in the court? How does that work?
So we do keep the data.
How long?
Right now, we just keep it for the length of how long it has it. There's no deletion date. There is a bill in the Senate right now for a certain amount of time to be held, and then it would be deleted after. So the data is very important for our constituents. As you know, that if there is a citation paid through state highway or through the, the system, if it goes to the NBA and there's a flag, they need their proof that they paid their citation. They come back to state highway and they say, can we have proof of payment? We then move it to the NBA to show proof, and then they can remove the flag. The other side of it is they go back to re-register their vehicle, which is that 2-year period now that's now offered. They go back and they say, oh my gosh, I can't register my vehicle. I have a flag on the vehicle. We need to be able to have that data to show them, here's your citation, because it's owed to them of a picture time just to confirm that was, what happened. So then they can take it. So.
And another thing, like the bill mentioned about the signage.
Yes.
That might be the public education. How do typically we do? Do you send a mail notification or radio announcement or community meeting? How do we do when we put these?
So that would be a good question for MSP, since they handle all of the notification and the public notice. The signage, I'm sorry, that was the notice, the public notice. The signage, we have the signage, we place the signage out. We normally have signs that are about 9 feet to 6 feet, 9 by 6, just depending on the width of the highway and the other signs around to notify.
Yeah. Mr. Chair, I was not involved in the subcommittee. I think in order to improve this bill, there might be the amendment already. if we could require an annual public report on effectiveness of the speed cameras, including.
Well, it's funny, you should mention that, Delegate Midari. You moved us to the next item on the agenda, but first, Delegate Allen.
Oh, I'm sorry.
No.
I didn't see you, but.
Of course.
I'm just thinking, again, they're concerned about the 104 miles of Beltway.
Right.
And again, of course, deferring to the bill sponsor and our speaker pro tem. Could a possible compromise be, a new notification period would be triggered if the camera were to be moved so many miles from its previous location, or so many miles from the previous location?
And this is an idea that then either I or John Carden can vet, because we really need to vet these with the NT first if we want this to happen. I mean, they're great ideas, and yet he doesn't want, and really, he's not picking on us. I just want you to know, he doesn't want a quilt of different laws everywhere in the state and different kinds of notifications. He wants there to be some consistency as these become more popular across the state. So he's trying to not have everybody write in their own things to an extent.
Yeah.
So, it's something we need to think about. And I think we'll come, hopefully, with, I imagine we'll meet with the subcommittee again this week, but we'll come with some good recommendations next week, and we'll see if people are willing to listen to them. Yes, Delegate Shalega.
Can you, because I'm not on the subcommittee either, can you describe what this looks like? Are these the cars with the cameras on them, with the Spotify next to them? And you're just gonna move them, or are these permanent, or what does the speed camera look like?
That I would have to go back to my team and to confirm,
I'm-
because there are different types of speed.
If I'm not mistaken, the cars with the cameras are for work zones.
Correct.
Okay,
The ones on 83 are fixed to a pole.
okay, okay.
And to the maker of the bill, your intent is more like 83?
That's correct.
Okay.
So the general feeling is they're fixed locations.
Wow. Okay, well, that kind of makes the notification even more important.
Okay.
Because you're not, moving them.
Right.
It's installing them, there's no
Yeah,
person.
I can't imagine SHA is gonna invest a whole lot of money. They're gonna pick their spots. I gotta believe they're gonna like their spots unless things improve dramatically, and hopefully they will.
Correct.
But I don't think they're gonna be like chess pieces. I really can't imagine SHA
Correct.
has the resources to do that, but for
Correct.
sure.
Apologies. We will be analyzing the data before any camera would be moved.
Okay, thanks. Delegate Long.
I had two questions. The first one was, he said something about lag time. What did that refer to when you move the camera from one spot to another? There'll be a grace period once they put the camera up there before they give tickets?
This is the nature of the question about the grace period for warnings. Okay, so right now,
I'm not talking about warnings, I'm talking about the project's up and running, you got a camera you're going to move, and he said something about lag time.
Mr. Chair.
Yeah, you got it.
What Simply said is that when we're talking about this 30-day warning period, and whether it was just at the start of the program or every time a camera is moved, when I talked with the state police yesterday, they said 30-day warning is just for the start of the overall program. But when a camera is moved, for all intents and purposes, they don't move it the next day. It takes what Catherine Kelly told me yesterday, typically a few weeks to move it. So it's not necessarily like camera will be moved and the next day it's going to be at a different location. It's going to be a few weeks before it's moved.
All right, my second question is, I have a lot of concerns about these tickets. She mentioned about going down and registering your vehicle. We run into it all the time with unpaid tolls. Are they going to be penalized? I mean, if you don't register your car every year or every 2 years, you have a ton of penalties and interest. And, if you move and you sit at the end you move and you don't know you have a ticket, I'm just concerned about, these fines piling up and with interest and penalties and stuff.
right, this is a larger thing because other jurisdictions are doing this as well. I haven't looked at the law, but my guess is that there are some requirements that they investigate license plates to make sure the car's not stolen or,
I'm not talking about that. I'm saying,
What are you talking about?
What I'm saying, if I get a ticket and I don't get a notification and I happen to move and I don't get a notification, I gotta register my car. They're not gonna let me register until I pay that ticket.
So are you suggesting a remedy for that?
Pardon me?
Are you suggesting a remedy for that problem?
No, I'm asking a question. I'm just asking a question.
Go ahead.
I have an answer with my previous experience in the NBA. So you must register your vehicle. That is in law. So there's a 2-year period. These citations do not, they do not have any interest or civil penalties attached to them. You have your flat fee. So when you come to the NBA and you have a flag and you say you're not allowed to register your vehicle, which you can now do online, they will tell you you have a flag. Once you see the flag, and they can tell you exactly where that flag is from, it'll be that flat $40 or however yes.
Okay, because I know it's different with tolls.
It is very different with tolls. We
Okay,
do not
thank you.
operate as the same.
Good answer. Thank you.
Mr. Chair.
Yes,
you've done both.
Yes.
Yes, I recognize you, Delegate Mendari.
Yeah, thank you, Mr. Chair. Yeah, the bill has a sunset 2030, 5 years. Do you think it's enough period to evaluate the effectiveness, or do you think we could expand to 2035?
That would,
To see the actual, evaluation.
I can tell you that our programs and our, the timelines, they are evaluated. When I spoke to Office of Traffic and Safety, they would like to evaluate at least once a year. So I will give the sunset time to the committee to decide how they feel on the length of time of the program.
Okay.
Thank you. All right, that's good. I think we can move on to the one, unless somebody else has something on that. There is a reporting, an amendment to require reporting. I think the reporting is just amount collected. That's suggested
It's
amendment.
just reporting on the revenue collected and how it's distributed.
Okay, and that would be uncodified language. And my understanding, talking to, well, I've been around long enough to know this too, that uncodified language, when you put something in, typically it doesn't go more than 3 years out. And so I know that you want a reporting in perpetuity. I mentioned to you yesterday, Delegate Shalega, I shouldn't say you, Delegate Shalega yesterday, that I thought we should back that down to 3 years of reports. And then if we really felt like we needed more information, we could re-up that. So I'll let you comment first.
Yeah, I would resist that. I think we very strongly, we need to put this in law because we are turning over our authority on speed cameras largely to the county. And they are creating a fund out of the revenue from these cameras that they're supposed to spend on reducing speeds, speed deterrence programs. So I believe it is our responsibility to see that data. How much money did you get and what did you spend it on? And then it also allows us to have a say in that. So, if there's a particular area in our district, we have Eastern Avenue, that is the second deadliest stretch of highway in the state, I think, or in the county. It's just horrific. If they weren't spending any money there or whatever programs they instituted, we had better ideas from the community, it'd be our chance to say, look at this, look at that. So I think it has more teeth if it's in law and they know that, they are going to do this as long as the program's in place.
And the drafter guessed at how often you think that report, how often?
Every year.
Every year.
I'd
What's
like an annual report to
Annual.
us, so we, while we're here in Annapolis, let's take a look at the report, let's get the report, we can even have that come presented to us.
Ms. King.
So the way the amendment is drafted, it does mention the county. This would be a state program, so the county would actually not have anything to report because it is not a county program.
And the money
The money would be coming to state highway.
first of all, to administer the program.
Correct.
Oh, sorry, I
Okay,
missed it.
and first, the first bite out of that comes to administer the program.
Correct.
And
And
then
then it
after
is
that,
going to the safety and as Delegate Shalega mentioned, to 695 and the 83 corridor.
is
So,
there any reporting requirement like this in the other places that you know of?
as far as I know, no,
Okay.
but please let me confirm.
Okay.
And do any other programs have this diversion program linked to the fund? Are we the first one to say the funds are going to be?
No, that is a regular.
That's a standard?
That's standard,
Okay, so
sorry,
that
standard.
we can do, okay.
Yeah, that's standard. So, if that is what the committee would like, we could make a report.
Okay. All right, so SHA doesn't really think it's tough, it's a heavy lift. Maybe we can convince ENT it's not yet, we'll see. I'll work on that.
Mr. Chair, I'm almost convinced that in the Baltimore City portion where these are occurring, I mean, we're getting literal annual reports from Baltimore City. I got 2 bills yesterday about it, talking about how the cameras are being used and all this sort of stuff. So I mean, somehow the city is pulling this together.
Double check that that's true, because that'll be very helpful for us in making our decision what we do with that. Okay. Yeah, I agree.
And I might be remembering wrong, but thank you, Mr. Chair, but doesn't Baltimore City maintain all the roads within the city?
Correct.
So I-83 in the city would be maintained by the city, not by the state.
Correct.
Thank you.
But are the other programs, Route 100, the only two I know of, Indian Head Highway, they are SHA projects then, just the speed cameras there.
I do not believe so.
They're all local too?
They get assistance.
Okay, so we're a little different.
Indian Highway not being state.
The only ones that State Highway runs right now is the work zone program.
I'm not sure if that's true, because we're coming back every year on Indian Highway in our committee to address that program.
I can, let me confirm, I'll of course reach out to Office of Traffic and Safety just to confirm, but I did ask him to make sure that any other highway in the state right now, it was confirmed for the work zone program, but I'll definitely double check for you.
So in Prince George's County, the county is deciding where they go, not SHA?
Yes, on the county roads, correct.
Okay, but isn't Indian Head Highway not Route 5 or Route 4, I can't remember, isn't it a state highway?
Yes. So that's,
210.
there's just, right, so there's something that I will just clarify with them, because I did ask that question prior to this meeting, and that's the answer I received, so I will definitely go with that.
All right. So we know where we are. We'll probably be, doing this again next week. Let's try to get it done next week if we can. Please, my God. Yes.
About the reporting.
Yeah, the council wants to ask a
Just to make
question.
sure we have it right. Delegate Schlegel, right now, the reporting is from SHA to the delegation. Is that how?
Yes, the way I misspoke, because I'm not on the subcommittee, and, right.
It's fine.
Okay. Got it?
Got it.
All right.
Thanks.
This
Good
point's
job,
written, I
Jerry.
just wanted to make
Kipple
sure.
King, thank you.
You're very
I don't
welcome.
think would have been nearly as productive without you here, because I really needed your input on some of that.
No problem.
We'll meet again next week, those of you who are still here. Don't forget, if you signed up to help out at the food bank, that's Monday at 9 o'clock. John would say, I don't do all this, but go ahead, John.
Yeah, it's at 9 o'clock in I sent out the link to sign up for it. There was a technical problem that they got back to me and fixed. So if you tried it, it didn't work. Go back to the link. I could also send it out right after the meeting as well.
And they're pretty open. If you didn't sign up and you show up, they'll just have you fill out some stuff when you get there. I've done it once before. So if you get a mind, you're thinking I'll go to Annapolis a little early and roll by there. You don't even have to stay for the full 2 hours. So looking forward to seeing some of you there on Monday. It's a good PR for us that Baltimore County Delegation cares. And so I'd love to have as many of us there as possible. We're adjourned. Wow, that's great. That works beautifully.
Chair, Delegate
Oh, no, do not do that. Oh, Chair.
Chair Eversole. Yeah. Eric, April needs to say something to Bonnie.
What?
She brought it to my attention, this is MDTA, but if anyone receives a text message saying that they owe Easy Pass through a text message, do not
Ignore
pay.
it.
Yes,
Right.
do not pay.
Right. I've gotten several of them.
Yeah.
Me too, I've got
Mine was one of them.
Yes, oh my gosh, I'm so happy.
Hey, Katie. Put that in the newsletter.
Yeah.
So people get it.
Yeah.